Hi everyone.
Hi everybody.
Hi everyone. Hopefully this is showing up now. So maybe if you just write a little comment just so we can see that you're seeing us and that the live video stream is working. Oh,
yeah, here we go.
Yeah, we can see that we're there. So if anyone just wants to comment and just confirm that you can hear us and see us, and then we'll get started in the next couple of minutes.
Oh, excellent.
So,
Thanks,
yeah, thanks Ashley, thanks Blade, high five, thumbs up, so that's terrific. So thank you very much. Oh, I can see, yes, quite a few people are joining. So thanks Jess. Jess is our practice manager, so she's watching in another room. So great to see that Taylor, hi. Everyone's joining. So hi Emma, oh, hi Jay. Oh wow, it's a really big crew. Thanks everyone. So look, I'm Dr Moncrieff. I'm not the plastic surgeon. The lovely gentleman to my right is. And so yeah, so we're the Moncrieff. So Dr Nicholas and Dr Moncrieff. And tonight what we're going to show you is a lot of stuff about breast augmentation. So we've been working quite hard, haven't we? I've been testing you.
Yes.
So some of the questions that lovely Trish from Plastic Surgery Hub, who works so hard to make Plastic Surgery Hub what it is, sent through lots of your questions. And what we've tried to do tonight is incorporate them into a bit of a presentation and answer them as we go, but also we've got some that we'll answer at the end. So our goals from tonight, I guess, based on what Trish asked us to do, talking about breast augmentation, but not just the easy cases, but some of the more challenging aspects of breast augmentation. And so we'll do that. We'll show you lots of pictures. I think we're probably both quite visual people. And so if you can see something, I think it makes a lot more sense. So I will bring the laptop a little bit closer to the screen when I'm trying to show you a few things. Just keep in mind that we have had to put stars over all the nipples, which is sort of a bit annoying in breast surgery because sometimes nipple placement is really the mark of a great surgeon. But if we didn't, it would be banned off Facebook, and this might, even as we're going live, be taken down. So we've had to make that concession. So yeah, so just quickly, yeah, we'll still go ahead with what we can. So yeah, so that's the goals for tonight. We'll show you at the end. So Jess, our practice manager who's here, will show you a bit about the Vectra. It's certainly one of the favourite tools, and in fact, I noticed someone commented, I think it might have been one of the ladies that's already commenting here, saying that she's actually got one booked for tomorrow, so she'll get a little bit of a preview of it. Nice to be that keen. But look, a little bit about us. So we've been in Newcastle. We set up Hunter Plastic Surgery. What year?
2009.
Good job. Also the year we got married, so it was a busy year that year. So Dr Moncrieff's actually been up here for 10 years. Then we moved up here from Sydney. And in that time, we've run a really busy plastic surgery practice. But Dr Moncrieff, what is your sole focus now?
So I really love doing breast and body work, and that's basically what I concentrate on now. I don't do anything else, and I dedicate my time to being, a master in breast surgery, breast reduction, breast lifts, and also in body work and body lifts.
Yeah, and by body work, he doesn't necessarily mean tattoos.
No.
He means tummy tucks and body lifts and things. So, yeah, I guess one of the big things, we talk about our 5-star difference. Dr Moncrieff is a proper plastic surgeon, and I know this group really endorses, the work of plastic surgeons, but he doesn't do a bit of everything. The days of doing skin cancers and facial work and all that sort of stuff, we just focus on that. And as a result, you've done more than 1,000 breast augmentations in the last 10 years,
9 to 10 years,
but certainly the pace in the last couple of years has really picked up. So very, very busy. All right. So a little bit about who our patients are, because I think, in sort of understanding, who breast augmentation is suitable for, who are we talking about?
So obviously we're talking about women of all ages. People come in for breast surgery from 18 up to 70. And, we treat women of different shapes and sizes. But mainly we treat a lot of mums in our practice. We do a lot of mums from sort of early 20s to mid-40s who may have had 2 or 3 children. They may have breastfed, and they've just lost some volume, especially in the upper part of their breasts. We call it the upper pole, and they've got some laxity maybe at the bottom of their breast, and they just want to restore mainly a bit of the shape back that they had before kids. And so this is where breast implants become very useful and are very good at correcting these shape changes. We often see a lot of younger women who've got very thin athletic bodies. We call them like a surfboard type body, and they just want a sort of a more natural enhancement, not being too big. And we do see a lot of that. We're doing more and more of that now. And also we do a lot of breast augmentation and setting and mass weight loss. So patients who come in, they've lost their weight, they've got some laxity, and we often do a lift first and then put some implants in, usually 6 months later. So there's all different shapes and sizes of women presenting for this, and you know, there's always a solution to a lot of the problems. And you know, we will go through this in a lot of detail with the women, trying to get them the best solution.
All right, well, we'll jump straight in. I'll keep looking down and looking up and seeing if we've got questions as we go.
Yep.
Thanks, Ebony. Great to see you on here.
Yep.
Finance organised.
Yep.
That sounds like you're on the way to a bit of Moncrieff magic. So what we'll do is we'll run through some of those hot topics that Trish asked us to address. Hi, Lynn. Hi, Sharon. Skin between the breast. So, all right, so we'll get to that, Sharon, just about some mass weight loss, and obviously a lot of these things are on our website as well. So, all right, so let's kick off. So the first big thing, one of the questions that Trish had sent through for us to address is the difference between anatomical and teardrop implants. So I'll just try and position it there. So
let's see that right, guys. There. So there's a teardrop there that Amber's holding up, and I'm holding up a round. Okay. And then you can see there, so the round is round in every direction, so it doesn't matter where you go, it's round. Whereas Amber's teardrop shape is smaller at the bottom and bigger at the top. So if you held it up, you know, other way, other way there. It looks like a rain. It looks like a raindrop, so or a teardrop. And you know, these implants are certainly newer to the market than the rounds, which have been in practice, you know, in use, I guess, for 50 years, and the anatomicals now have been used for sort of 20, 25 years. But basically, the difference is that the gel also is a lot squishier in these round implants, with the gel in these ones a lot thicker. It's a lot firmer, and it gives, I think, a better shape to women's breasts using these implants than the squishy soft ones or the round ones. That's not to say I don't use round, but my majority of my practice is using shaped implants because I think they give a lot better shape to the breast, and that this operation is not just making them bigger, it's about shaping them. And these implants are good. They do hold, they have more memory, I think, in them. So I think the thicker gel that's used in these anatomical implants tends to be more long lasting in terms of the shape that it provides. So when do I use shaped implants? When do I use these round implants? So I'll just get to the round implants first because I do less of them. But for women who are before kids, they've got nice tight skin, they're small breasted, these round implants are certainly very suitable, and they can give you a nice sort of augmented look. They can provide full cleavage, they can provide lots of volume in the top part of the breast, and they can certainly give very nice looking results. I also use these round implants, so women have had mass weight loss and might have had a lift, and then we've cut out all the skin that's lax at the bottom. If they want to go ahead and have a sort of fuller looking breast augmentation, I will use these rounds in that setting. So, but they're really the only two instances where I use them, and the majority will be the shaped or the teardrop implant. And as I said, these have got this fullness at the bottom, and this will help kick out the breast and help shape the lower pole. Now, this is the thing, ladies and gentlemen, if you're really serious. Okay, I thought there might be some men watching, but if you're really serious about doing this operation well, you need to get the lower pole right, the bottom of the breast right, and this is what these implants do. They really have revolutionised, I think, breast surgery practice because they give so much great shape to the bottom of the breast. Now, anyone can make the top of a breast look good by either using a shaped implant or a round implant, but it's at the bottom which is really key in getting the really great shape. And I just don't think you can get that with a round. Firstly, because you've got more volume at the bottom, so you can shape the bottom better. But also the gel, it's super thick and it's super strong, and that's what gives it the great shape. So my practice is basically an anatomical practice or a teardrop shape practice. But having said that, we will use these rounds in certain settings, and certainly it comes down to patient preference.
And we should note that these are actual implants. So this is a real implant. This is a 440. That round is a 450. Yep. So for the same kind of volume, yep, you can see there one is giving you much more projection outwards. Yep. So we'll show you some photos later how it still creates cleavage even using the teardrop. Yep. But in terms of where the weight, particularly if you want that kicking out,
Yep.
which most mums do,
Yep.
then that's the one. These are Mentor implants.
So yeah, we only use Mentor implants. I've been using them for almost 10 years now. I've been very, very happy with the product, and Mentor stands behind their product, and they'll give women a 10-year warranty on these implants. That is to say that they have any problems in the first 10 years, they'll replace them free of charge. So they really stand behind their product because they've got millions of implants used worldwide, and they know that they work, and they know that they last. And Mentor implants I placed 10 years ago are still working very well today, and I've really had to revise very, very few of them. And I would expect to tell most women that you should be getting somewhere between 10 and 15 years out of these, possibly longer, if you don't go on to have a lot of kids or have big weight changes. So the implants themselves are very, very stable. They're very good. And, really, they've been, there's some 50 million plus women in the world have got implants, and you can't use them unless they're very, very safe.
All right, so just a couple of quick questions. I hope that answers Kirsty's question about how long you would expect to get from a teardrop. So about 10 to 15 years. Brianna's just asking, in relation to a tummy tuck and a breast lift, could it be done as one surgery?
Yep, definitely.
All the time?
Yep.
And would it help avoid the square look, so the teardrop? So I think it's probably, we could sort of talk about it later, but the drop and fluff concept, often, and you see it on this page, people say, I'm really worried because it's got that very square look.
Yeah, I don't see it. The breasts obviously look different 1 week and, or 1 day, 1 week, 5 weeks till they will at 3 months. So they'll start a little bit high to begin with, but then they'll drop into the pocket if the pocket's done correctly. And they produce this lovely round shape at the bottom. It's this thing here that really shapes the bottom, and that's why I like them so much. And I don't think they produce square-looking implants. I think it's because the gel is so strong that it really expands up that lower pole at the bottom of the breast, and that's what gives the great shape. So look, I haven't found it to really show a square shape, but I guess, look, it depends on the way they're done.
Right, so we might get on just quickly. What about arms too? Presumably in the same surgery.
Yes, we do that. We do arms.
Obviously, with mass weight loss, often the surgery is staged. So just to make the recovery, what happens to the implants after the 10 years?
Nothing happens. They're fine, and look, they might be in a woman's body for 40 years without a problem. It's just that we know from looking at lots and lots of these patients is that sometimes they can get something called capsular contracture, where the shell around the implant goes hard. And basically, they've just looked at what is the average time to replace an implant after a woman's had one, and they think, and the scientists at these companies think it's somewhere between 10 and 15 years. So that's why we say that, because that's what the data shows. But if you're having no problems with it, then you've had regular checkups, mammograms, ultrasounds, there's no reason to move to having them replaced just because someone told you 10 or 15 years.
All right, so we might move on to dual plane. So for those of you that sort of, we call it dual plane, but you might call it overs or unders the muscles, and then a combination of both. So we will actually show you an example of this in a minute, so breast lift with an AUG. So we'll bring this a little bit closer just so Dr Moncrieff can demonstrate the actual.
So I hope you guys can see there. So we're just talking about where the implants can be placed. Now you've probably heard about people talking about, I've got mine over the muscle or I've got mine under the muscle. So these are very common expressions, and you can see here on this diagram here, it's called a subglandular position. So the implant is placed over the muscle, and that's the muscle there in red circled, and the implant is placed between the muscle and the skin of the breast, and that's called subglandular or under the breast. In this instance here, you can see the muscle here in red, and that's the implant placed in the submuscular position. And that's a very common position. It's been used very, very widely for the last 35 years and still very common in practice today. And it gives you nice protection to the implant. It holds the implant in place and tends to stop them dropping. Whereas the subglandular position is good because it expands up the breast skin and really shapes the breast nicely. But the problem is over time is the weight of the breast cannot be supported by the implant, so they tend to drop. So where else have implants be placed? But where I really like to place them is this called dual plane. So this is dual plane, and it means that the half of the implant, you can see here, is under the muscle, and then the remaining half or third or where it is can be placed under the breast. And I think it has the advantages of each of those two placements. So firstly, the implant's protected and it's held in place by the muscle at the top here. But the lower pole is where we're saying the shape change has occurred is better if it's exposed to the breast. So that's why the bottom half of the implant is sitting under the breast and can really affect the best shape change. And that is I think the key thing about this technique. It's certainly harder to master, but I think it gives more longevity to the result and really gives you lovely natural looking results.
All right. So hang on, I'll just check. Muffled sound. Sorry. So can someone just let me know if they can hear it now?
Good.
All right. Can we hear it? Okay. I'm just checking if anyone can let us know if they can hear it now. Yeah. Okay. So just you saw the photos there, but what were you saying, Dr. Moncrieff, in terms of all of that?
Basically, I'm just saying that the dual plane placement is really good because it holds the implant, is held by the muscle at the top, and that where the implant's covered by the muscle in the top half of the breast, and then the bottom is where the implant is exposed to the breast. So that's called the dual plane because half the implant is covered by the muscle at the top and the breast at the bottom. And it gives, I think, the best longevity in terms of the result. Because the muscle tends to hold the implant up, and it also tends to shape the breast, especially in the bottom half that we were talking about before, and it gives really great shape change to the bottom of the breast.
All right. So sort of combining those two concepts, so the concept of the teardrop implant and the concept of the dual plane, we'll now move to Scarless lift.
Yep.
So we were talking about this last night. So people were saying, is it actually possible to have a lift without a scar?
Well, it's impossible because we can't do a surgery without a scar making a decision. But Scarless lifts is something I guess we specialise in because we do a lot of mums who've lost volume at the top and got laxity at the bottom, but they want to get away with not just having the lollipop scars that you might be familiar with or the anchor scars, and they want to get away with an implant alone. And we certainly can do that in certain situations where the nipples are pointing straight ahead. We've got some not really big areolae, or we've got some skin between the bottom of the areolae and the breast. In those instances, we can use a dual plane placement that we showed with an anatomical implant to really expand up that lax skin that we're seeing at the bottom of these people's breasts.
So what we'll do, because obviously you can't hear the audio when I bring it closer, so we'll just show a couple of pictures and then Dr. Moncrieff will talk to them.
Yeah.
I think the summary of all that is when we say it's a scarless lift, what we mean is that it will not have the scars that are normally associated with a lift, being the big lollipop scar around the nipple and down the breast. But of course, it will still have what we would consider a normal augmentation scar, which is that 4.5 centimetres under the breast. So we'll show you some examples now, and hopefully then that will sort of make it a little bit clearer. So first of all, we'll just show you the befores, and then we'll talk the befores. All right.
So you can see all that, guys, hopefully. So you see here's a mum. She's got 2 kids, I think, and she's got some laxity you can see at the bottom of the breast. But the key point here to consider is that the nipples are actually pointing straight ahead. So
I'll just show you that. So what you can see there is that the nipples are still pointing straight ahead.
And so in this instance, we'd consider doing, this is a scarless lift, so using the implants alone to shape the breast and to stretch that lower pole, lax skin at the bottom of the breast and to stretch it up. And this is exactly what we've done. And I think Amber will show you the afters now. And you can see now from there, guys, the nipple is now placed in the center of the breast, and we've basically expanded up using a shaped implant or an anatomical implant, the lower pole of the breast, and given that lovely breast shape. And that is called a scarless lift. So there's no scar around the nipple, there's no vertical scar, there's no big cut underneath, it's just a 5 centimetre cut at the bottom of the breast.
All right, so there won't be any sound when we just show you the PowerPoint, but then we'll bring it back and continue talking. So, yep, so can everyone just hear when we are actually talking? Yeah, so we'll just show you again the result.
And that's a typical Scarless lift result that we would expect to see in the right patient.
All right, so
here's another example of another example of a Scarless lift, and we'll just show you again that the shape changes and the volume that happens from just doing implant alone. You can see, guys, that the lower pole has been driven up by the shaped implant and given her the volume that she wants, and without the need of a scars. And a lot of women, rightly so, do not want to have the traditional lift scars on their breast if they can get away with using appropriate size implant done in such a way in the dual plane placement to give them, you know, the look they're after, and especially without scars is a big plus.
Yes, we don't want to talk down lifts for some patients, definitely, and we'll show you a good example in a second. A lift is definitely the right operation, but for these sort of patients where that nipple's still in the right sort of position and it's a reinflation, this is the solution. All right.
So we're also going to talk about now, do I need a lift? And this is a question we get asked a lot. We get sent lots of pictures every week of someone saying, do I need a lift when I implant alone? So there are certain situations in a women's breast where if the nipples are too big or the nipples are too low on the breast or they're pointing down, then we actually recommend having a lift. And the way that I tend to recommend it is having the lift first, then waiting for 6 months, and then going back and having the breast implants, because we know that the scars don't stretch when you do the implants and the lift separate, because sometimes after doing it together, so in one operation, we find the scars, especially around the areola and along the vertical limb, can stretch. So now we've taken to doing them in 2 operations in the appropriate patients, and I think you can see that the results will speak for themselves.
I'll show you in a sec. So obviously the noise will go, the volume will go again, but what you'll see is the before. You will then see post the lift. So then that was allowed to settle for several months before the implant was placed in. And that is really to get those lovely fine white scars that you see in this patient at the end, as opposed to many of those patients, including when I see on this page, that have had it done in one hit, and the pressure of that implant's just been too great and the scars have really stretched out. So it is possible to have it done in many cases in one, but in lots of cases we say no, stage it. Yes, it is more expensive, but if you want those thin little white scars rather than those big sort of angry red ones, this might be something to look at. So I'll show you the pictures and then Dr Moncrieff will talk.
Okay, guys, so you can see the before picture was a lady who'd had breastfed 2 kids, and she made it difficult. It was difficult for her to get the volume that she wanted. So I said, because the areolas are very big and they're at the bottom of the breast, that she needed to have a lift first. And that's what you can see in the second photo, where you can see the lift scars, they're around the areola and down. And then we've gone on to do the breast implants 6 months after that surgery, and then you can basically barely see the vertical scars or the scars around the nipple, even though it's hard to see with the stars on them that Facebook make us do. You can still, it's very hard to see the lift scars, and that is the advantage of sometimes doing it in 2 operations.
So I'll just show you that one more time, just so that sort of, now that you've explained it a little bit more. Right.
So yeah, so that's I think, you know, it's definitely the way to go, and certain people should certainly consider that if they're one of those women where it's not suitable to do it just as an implant alone.
Right, so we've now got tuberous breast. So what are the things that indicate a tuberous breast? Is it just a small breast?
Yeah, so this is a really good question, and one we get asked a lot of. It's not just small undeveloped breast. It's actually a fact that the tuberous breast condition is basically a congenital anomaly, so something that people are born with. And basically what happens is the breast doesn't develop fully and normally. So basically during puberty, the breast doesn't reach its final shape and size, and people are left with breasts that can be very widely spaced apart. They can have this puffy nipple or puffy areola, which we see commonly. We can see this triangular shape, or it's sometimes called cone breast, and often the breast fold is very, very high. And that combination of features of the breast can indicate that this is a tuberous breast. And, you know, we probably see it in 5% of all women presenting for breast augmentation. So it's not uncommon. And, you know, if you've got some of those features, it could be very well be you. So how do we treat it? We often treat it with breast augmentation. We often treat it with fat grafting. And there's a myriad of techniques we can use to basically basically inflate the breast up using an implant and basically dilute the breast. We're using implants to basically cause shape change because we know that they can, and we might even combine it with a scar around the nipple to narrow the areola down, because the areola is often very big in these women. And you know, it's a difficult condition to treat. And sometimes we do it in 2 operations, where we'll do a lift first and then put an implant 6 months later. But it just depends on how severe the condition is, really, depending to guide us what to do.
I might show you again the before and the after photos, and then Dr Moncrieff will talk about it, and then we'll just show you sort of like a close-up of it. So just keep in mind, so this lady was in her 40s, was a mum, but hadn't been able to breastfeed. The tuberous breast really made that quite difficult.
Yep.
So we'll just show you her photos. Sorry. Straight through to the afters there.
So yeah, so you could see in the befores, you had very widely spaced breasts. You could see there was puffy areolae. The breasts looked quite triangular or cone shaped, and the fold was quite high, particularly on the left. But I think what struck me also is how widely spaced they apart are. So in that instance, we use a cohesive gel, like a shaped implant, quite a good size. It's a 440, made by Mentor. And the idea is then, and we put that implant in that position under the breast. So it's actually not under the muscle or dual plane, it's under the breast. And then we use fat grafting to disguise it, to narrow the cleavage, and in order to achieve that result. And I think, you know, you can see it's quite a significant transformation for this lady who's always been embarrassed about her breast. Now she feels like she has a normal pair of breasts that's normally on a chest wall.
All right, so we'll just show you her final sort of before and afters again, close up. Oh, thanks for a nice comment there.
Yeah.
So I guess the important thing to know there is normally you are a big fan of dual plane.
Yep.
It wasn't appropriate in this case.
So yeah, we try to dual plane as much as possible, and the reason we do that is because the muscles holds the implant in place and stops it from falling. But in some instances, you actually want the implant harder get up against the skin of the breast, so it can shape the breast and give the breast the best shape. In that instance, in severe tuberous breasts, we will put them under the breast.
Okay. And also, you know, we've talked about how tuberous breast, it's not just a small breast. So we see even in larger patients,
yes,
there's still that characteristic shape.
Yep, that sort of triangular, sort of cone-shaped looking breast, big puffy areola. It's not just a small breast. And, you know, we do quite a lot in this practice. We only do breast and body. So by default, I guess we do a lot of it. And, you know, there's often a combination of treatments that we will use to get the best breast shape.
Okay. So then I thought, so we've dealt with a lot of those sort of more challenging cases, so the Scarless lift and then the staged organ lift, tuberous. How about a relatively nice, easy one?
Yeah, I think it's always good to get back to the bread and butter, which we all certainly enjoy, because it means that, you know, this is going to be hopefully a pretty standard, straightforward case. So we're going to talk about the patient who comes in, who's thin, who's got a very nice body but just doesn't have much volume in a breast and wants a better breast shape. So we might show you a picture of that now. Yeah, yes. Yeah.
All right. So this is this patient before.
So as you can see, as I said, thin body, you know, not much in the way of breast tissue, probably an A cup, and she wants just a bit more volume. She's quite sporty, athletic, and just feels she'd like to be a bit more womanly and just with a few more curves.
All right.
So I don't know if you could see the screen, but there's a question put to the group there. And so, guys, what do you think those implants are? Are they round or are they anatomical?
So if you can just comment below. So we might even just go back and we'll just show you. So we'll show you as you do your guesses, but comment below, do you think these are round or anatomical implants? Oh, I'm not sure if anyone's responding there, but I think, yeah, Jay thinks round, yes.
Round, yes. I mean,
Tanya thinks round, Leah thinks round.
They're good, they're very good comments.
Yes.
Beck, yes, good. Taylor, anatomical. Leika, round. Sharon, anatomical. Carly, round. So I think there's more rounds than anatomicals. And this just goes to show people that you can't ever tell. And when you guess, 50% of the time, I think you'll probably be wrong, and they're actually anatomical. So what it goes to show, guys, is that you can style any type of breast you want if you know how, and you can get an anatomical to look round, and you can get a round to look anatomical, but that is harder. That is much harder. But definitely, that's why I like them, because you can use them in so many situations, and you can create totally different breast shapes and profiles for people who think they've got an idea in their mind that they definitely want round. But you know what? I can do it by using a shaped or anatomical implant.
You still get the benefit of the anatomical because you're getting that
longevity, the thick gel. You're getting, the dual plane. So I think the thing is, guys, I don't tend to dual plane a round implant, and because the benefits come in the fact that the implant is asymmetrically manufactured, so you've got more gel at the bottom. And when the muscle squeezes down on the implant, it squeezes the gel into the bottom of the breast.
We might just show that one again for those of you that had guessed round. This is probably why. So most people sort of see that nice full-looking cleavage, and what do they think?
Oh, that's definitely a round implant, and that's the thing. You can, if you know how to use this technique, this operation, you can create anything, and that's what I think really good breast augmentation surgery is about. It's about shaping breasts, not just stuffing an implant into a pocket and going, that's good enough. And that's what we really try to do here at Hunter Plastic Surgery, is really shape the breast well. And I consider myself a breast shaper, not a breast stuffer.
Yeah, so look, sometimes we do get phone calls from people that have gone and seen a cosmetic surgeon. So anyone that's a GP can call themselves a cosmetic surgeon, and they say, oh, I've been told not to have the teardrop or the anatomical because it might rotate. How many of you had rotate, Dr Moncrieff?
Look, I've had one of my own, but I've seen a lot of other people. But the trick to getting them right is when you make the pocket just big enough for the implant to get in, because it is bigger at the bottom than the top. That's how they're made. But if the implant can barely get into the pockets, like a hand going into a glove, they just don't. There's no room for them to move, and they just don't move. So I think that's in practice a theoretical consideration. A lot of surgeons will say, no, have round, because it's easier for them. It's only easy for them to don't worry about and set and forget, and goes, well, if it's round, it doesn't matter. It doesn't change the shape. But the advantages of anatomical, I think, far outweigh the technical considerations of making a tight pocket.
So the summary is lots of people will say round because they don't want to spend the time, or they don't have necessarily the knowledge. In saying that, there are lots, we still do rounds, and there are lots of our colleagues that do rounds for lots of different reasons. But if it's simply just because the surgeon wants to be out of the operating theatre that bit sooner, then that's not a good reason. You should be asking that question. All right, so we'll get on to fees. So, I always say in our practice that it's not Dr Moncrieff's job to talk about fees. He's not supposed to learn every Medicare item number and what rebate it gets from what health fund and things. So usually in our practice, you'll meet Jess. So she's the one that you'll meet doing the Vectra stimulation, but Jess will talk to you about fees. So the important thing about our fees, they're all on the website. So if you go on our website, it's sort of all the permutations. So whether you're insured or uninsured, obviously certain procedures do carry an item number, but also it's a total fee. So it's a total out-of-pocket fee. So that's the surgeon, the anaesthetist, the hospital, the garment, the aftercare, everything. So that's one fee. It just makes it really easy. I know some other practices get you to go off and try and get a quote for an anaesthetist, and the hospital, oh God, what a nightmare. So that's not what we do. We just make it easy for you. So in terms of cost, So a breast augmentation with an anatomical implant as a day case at one of our properly accredited hospitals up here. We don't do it basically in the rooms. That's just over $11,000, so $11,100, about $600 less for rounds because round is a cheaper implant. A cosmetic breast lift. So, you know, you saw the lady that had it in 2 stages. If she'd stopped in that middle stage, and some people do, don't they? They have the lift and they say, well, this has solved my problem because
they don't need the implant. And, you know, a lot of patients will go and say, no, I'm happy. I thought I wanted implants, but I'm happy to do it.
So if it's a cosmetic lift, and that really just means that you are doing it for cosmetic reasons, there's not a medical need, which would have otherwise got an item number, but that's $16,000. Yep. And so obviously that reflects all the same things, the hospital, the surgeon, etc. A lift plus implant. So this varies from $19,000 to $25,000, depending on whether it's done in 1 stage or 2 stages. Again, for some of those smaller, less complex lift with orgs, it can be done in 1 stage, but certainly in our practice, we see a lot of people that really would get a better result with 2. Yep. And, you know, sometimes they do argue the toss and they say someone else they know will do it for less and do it in 1. Good luck. We're not their practice. So that's okay. A breast reduction. So for those of you that might just be joining us because you're interested in a breast reduction, if you've got insurance, that's $10,500. And as I say, all the fees are on our website. A consult with Dr Moncrieff is $250. A Vectra, which we'll show you in a second, is $50. But if you do decide to go ahead for a consult, you don't have to, but then that $50 just comes off your fee, doesn't it? Yeah, so it, you know, we encourage lots of people to do that. They just find an easy way to have a look at what's really possible and see lots of our before and afters and just sort of get our vibe.
And just meet the girls. Because, you know, some people will find a great place and some people might find it's not their cup of tea. So that's
maybe we're a bit conservative.
Maybe a bit bland.
We're not bland, we're just a bit careful. All right, so if you want more information, I'll just show you this for a second. It's basically just saying, you know, follow us on social media, at the Hunter Plastic Surgery Facebook or Instagram page. On Instagram, it's really good because you can type in Moncrieff Magic and see lots of real patient results. So we'll just sort of show you.
Whet your appetite.
Yeah, so lots of patients are happy to share their own experience. You know, we've got lots of reviews. I'm not allowed to talk about reviews, but, you know, if you are on a search engine and you were to look it up, but, you know, obviously on the Moncrieff, if you type in that hashtag, lots of people will share their results and you can see what are realistic outcomes. I did see a lady actually just posted just before we went on saying, should she bring in pictures for us? What do you think? Do you like it?
Yeah, great. Bring in pictures. Tell us what you like. Tell us what you don't like. Because that helps us, helps me anyway. Choose a particular size of type of implant, size of implant, the pocket, all those things to get the result that you're after.
Yeah, and just keep in mind though that it's got to be like with like. So, you know, if you're someone like me, so in my mid-40s, having had 3 children, the realistic outcome is going to be different from a girl in their 20s who's never had children. Yes. So just sort of understanding that, you know, you'll definitely try your best. Yeah. So someone like me could be, you know, a supermodel. Right? But
what do you say to that?
Yeah. Anyway, we won't get into domestic disputes. And then, of course, the website, that just shows the website. Definitely worth having a look at. All right, so the Vectra. So we'll go through now and we'll show you what happens in that room with Jess. So as you say, $50, and that comes off the consult with Dr Moncrieff if you want. A lot of people really love it. It's fantastic for breast augmentation, fantastic for smaller breast lifts and reductions. If, however, the nipple is really, really low, sometimes that can be a bit of a challenge for the simulator to really assess where that would go in its simulation. So, but look, there's still lots of good things about coming in for a Vectra, even if on the day we can't get you a fabulous one if you're in that category of those that are really, you know, with lots of laxity kind of breast reductions and lifts. But with no further ado, we'll take you through. So yeah, so now you can come on the road through Hunter Plastic Surgery. I'll just show you while we're out here. So this is our sort of reception area. We have a little patient education and meeting room there. and then we'll take you through here. So we'll just go past a couple of our treatment rooms. So we do things like fat freezing in here, and we have a couple of similar rooms that we do post-ops. But this is the room with the Vectra. So you can meet our beautiful practice manager, Jess.
Hello, hi everyone. Thanks for tuning in and welcome to our photo room and our Vectra room. So all the magic happens in here. So we take all our before and after photos in here so they're consistent, but we also have our amazing Vectra machine to help with our simulations. So what happens in the Vectra appointment? So we come in and we get you in a robe and we get you to do your bra off, and the machine just takes a photo and just scans, so you don't have to put your breast in the machine. Some people thought it's not a mammogram. So it then takes a photo and uploads to the computer, and we can play around with different sizing. So for Facebook, we have got this lovely lady in.
We might get you to talk to
For Facebook, the lovely lady is in a bikini, but you can, I'll just point to it now and you can see the difference. So she's quite big. This is a reduction example, and then you can see with them lifted and a lot of the weight taken out. So I'll just point to that now for you. So before and then after, much smaller, lifted, perkier, looking a lot better. And then obviously, of course, breast augmentation. So again, this woman that I'm showing you the example of is in a bra, but you know, we can try different sizes. There's not one size we can try. We can go, you know, moderate and a little bit bigger just to play around with the sizing. So this is an example. So small, moderate, and a little bit larger. So yeah, the Vectra simulation, we find it very reassuring for patients, because if they've already seen Dr. Moncrieff and they're, you know, worried about sizing and things, this gives them a little bit of an example to see, you know, the sizing's not too big on their body, or just showing, you know, with different lifts and reductions, what you can get out of it before committing to surgery. So it's definitely a great tool, and if you're interested, please come and see us.
All right, everyone. So yeah, just important to note with the Vectra that obviously we're not the only ones that have it. Lots of plastic surgeons have it. So it's definitely worth, if you're looking at having a breast aug, at actually asking if they have the Vectra, or there's a few other systems like there's Scarless and things. So they're all quite good in just helping you understand what's realistic and possible. And again, just remember that when you do it, you'll actually see on your own body without the bikini on. So we've only had to do that for Facebook tonight, but you actually get to see the full thing. So excellent. Well, thanks, Jess, and thanks, Dr. Moncrieff.
Thank you, everyone. Thanks for listening. It was really good, and hopefully it's informative, and hope you learned something.
But yeah, so yeah, go and check us out on our website or our Facebook and Instagram page. If you'd like more information, send us an email. You can send it on the website really easily tonight if you like, and we'll get back to you tomorrow. But look, thank you very much for spending some of your Wednesday night with us, and thank you so much to Trish for giving us the opportunity to show you a little bit about what we do. Thanks, guys.